We know that between 3 and 4 mums in every 10 experience birth trauma. And we also know that those numbers have increased during the global pandemic, which means that now more than ever we need to be better supporting our new mums in that postpartum period. This video helps to share some of the issues around birth trauma. And it also helps you to understand, as a supporter of a new mum, how you can make a real difference to their short-term comfort and their long-term healing. My name's Sarahjane Watson, founder of Fit Fanny Adams. I moved away from the traditional role of physiotherapy so that I could focus specifically on bringing the correct health, fitness and restoration to the lives of pregnant and postpartum women, specialising particularly on the core and the pelvic floor restoration. So let's dive in and take a closer look at what exactly is birth trauma. Birth trauma is really poorly defined, but we know that there are some common themes around traumatic birth, and those are typically emotional and physical. So factors such as labour length, size of baby, the presence of interventions, a longer pushing phase, the position of baby are key factors, but also when it comes down to anxiety, fear, control, the lack of control, the lack of consent, and those types of fears around anxiety and our confidence and control in this situation can really contribute to the presence and existence of birth trauma. So let's look at how birth trauma can present. Well, if we think about a long pushing phase, which may end up in either an assisted birth, a spontaneous vaginal delivery, or a C-section, it can still lead to a lot of strain on the perineum and the pelvic floor. So that can present as strained tissue, or it can present as actual tearing. There are different grades of that tearing, and you may also have had the presence of an episiotomy as well. An episiotomy is a specific medical incision around the vagina to create a little bit more space for the exit of baby. The presence of an episiotomy may also come with a tear as well. So those grades of tears depend on the degree of the tear and the associated tissue. A grade 1 and a grade 2 are the mildest. So a grade 1 is very small tearing, just really around the vaginal entrance, not going into deep tissue. A grade 2 tear, which is the most common tear, is around the vagina and also into the perineum, but again, not going very deep. A grade 3 tear is where we start coming beyond the vagina, into the perineum and into the muscles of the anal sphincter. So the back passage and that anal sphincter control is typically involved. A grade 4 tear, which is the rarest, comes all the way through the perineum into the anal sphincter, and it completely tears the anal sphincter and penetrates into the rectum, the back passage. So we can start to see with the degree of that tearing how the whole area and the whole function of our pelvic organs and our daily function around bladder and bowel habits can really be affected. So let's take a closer look as to how birth trauma can present. When we're talking about birth trauma and how these may present physically and emotionally, I really want to focus on probably the biggest 5. Those are prolapse, bladder issues and bladder dysfunction, bowel management and bowel dysfunction, pain, and also the issues of self-confidence, body image, and intimacy. So let's start with prolapse. So prolapse is a descending of the pelvic organs into the cavities of either the rectum, the back passage, or the vagina and the vaginal vault. The types of prolapse that can happen really result from the strain, particularly if there's been a long labour length and an extended pushing phase around the tissue of the pelvic floor and the pelvic organs. So vaginal prolapses can either be anterior or cystocele or posterior or rectocele. So when we look at the close proximity of our bladder to the vagina and the rectum to the vagina, we can really see how any strain and weakness in that vaginal wall tissue means that either the bladder or the back passage can just sort of fall into it because the strength of the tissue isn't holding the two organs separate. So that bladder descending backwards will present as a cystocele, and you can see as that bladder presents backwards, yes, we're going to get the awareness of the prolapse, but if any urine is trapped, fluid is trapped in that bladder as it's descending into that vaginal wall, then it also can impact the ease with which we empty and void our bladder. So that is something that we need to be really careful and mindful about, is making sure that our postpartum women who are feeling symptomatic are really fully voiding, because retained fluids in the bladder can lead to things like urine infections, which we clearly want to avoid. So looking at the back passage, again, similarly, if that back passage is just imposing in that vaginal wall, it can make the passage of bowel movements difficult and uncomfortable, and sometimes really impact that feeling of voiding and not being fully empty, because we feel that we've still got some matter that we can't pass out because it is slightly trapped in that vaginal wall. So those are the presentations physically of prolapse. How it feels to a woman can often be described as a sensation of heaviness, or dropping, or dragging, or bulging, or almost feeling that there's sort of a golf ball or a ball sort of lower down in the pelvic organs. They may or may not be able to see anything, but it is really, really important that that mum is referred back to the GP or their caregiver, a health professional, midwife or health visitor, and has a thorough examination. And from there, they will be able to get the support that they need. So let's take a look at bladder dysfunction. And bladder dysfunction can be something that is a real shock to new mums. So it can be as simple as a complete lack of awareness and lack of sensation when they are going to the toilet and having a wee. They might feel totally unable to control and to stop the flow of urine, or to be able to hold that urine in on those very early days. And that is something that is completely normal. It's really important that this isn't ignored though. And it's also important that that is recognised as a sign to make sure that you keep an eye on things and check and get help as it is needed. Bladder dysfunction can really start to present in a number of different ways. So urge incontinence, so that's feeling a sudden and overwhelming urge, I've got to go to the toilet. Stress incontinence, so when we apply stress to the body, i.e. through coughing, sneezing, lifting or moving, then that can typically cause weakness in the bladder function and we have a leak. The other type of incontinence is overflow, when we're not able to hold a full bladder. And those types of issues can really be exacerbated in the early days postpartum. Looking at bowel management, we can see how, particularly with grade 3 and grade 4 degree tears, it is more common than not to have associated bowel dysfunction. And that can be really, really traumatic for the new mum. It can be incredibly isolating, and I think this is something that really needs to be supported incredibly tactfully and caring. There can be a lack of awareness around any type of control of either wind or fecal matter in the bowel. So the mum can feel that she cannot control her bowels. She might pass a bowel movement without being aware of it. She might also be feeling that she doesn't feel fully empty if she's had a bowel movement, and that there's retained matter internally. Similarly, there can be a frequency of having to go because there is a lack of control. If there have been stitches, and again, if there has been also a C-section, actually having a bowel movement can be quite traumatic and painful if there is a lot of stitches and wound healing going on at the same time. So it's really important that those mums are given the right support, and it might be that a short-term laxative can be prescribed and sourced from their health provider, and also that they're giving some gentle perineal support whilst they're having a bowel movement, and also some abdominal support if they've had a C-section as well. So let's look at pain. Pain can be such a fatiguing and a traumatic issue for mums, particularly when it comes to pelvic pain. Pelvic pain can often be associated with a lot of tension. So holding on to that trauma in that pelvic cavity can be quite common postpartum. So a really nice technique is to support the breathing of that mum, and to really encourage that nice belly breathing that we know. Pain is a real issue, and it is important that that's recognised, that things aren't right, and again is important to signpost appropriately for help if the mum is experiencing pain. It's also important to recognise that if that pain is not subsiding, if it's worse at certain times, or if actually it's increasing, that is again a huge flag to go and get more help. And then we look at the issues around self-confidence, body image, the feeling that the body is significantly different if there has been birth trauma, and around feelings of a reluctance for intimacy and avoiding any intimacy and close touch, which can be a real factor. And I think in those instances, it's really important that we really signpost for support mentally and physically for those new mums. So we've had an overview of how birth trauma can present, and that can be through, as we said, prolapse. It can be through bladder dysfunction, bowel dysfunction, pain, and huge issues around confidence, feelings of isolation, not wanting to go out, and also those issues around intimacy and lack of loving of an area which for them historically they knew and were very comfortable with. In the next video, we're going to really be digging deep into how you can be supporting mums going through and experiencing any of those issues. We at Babyem are passionate about empowering new mums. We provide you the support to help them. If you've enjoyed this video, please do hit the like button because it really helps support this channel. And don't forget to hit subscribe so you can be notified when we upload a new video each week. Thank you.